Hello, and welcome to our Heart Health series. This episode is over nicotine and alcohol. This is presented by the Abilene-Taylor County Public Health District. To introduce this topic, we want to note that our primary focus is on nicotine and alcohol, as well as that using substances is not a personal failing. There is a lot of stigma relating to using substances, and people can use them for a lot of different reasons, whether it's your mental health, having certain routines or triggers, a social physical environment, exposure, whether it was in youth or just socially, as well as certain biological factors. So we know that there's a lot of different reasons why someone might engage with substance use, and that does not mean that they are failing as an individual. We simply want to focus on the fact that things like nicotine and alcohol do have impacts on your heart health as well as your overall health. And we want to do our best to try and minimize the impact of those on our health overall in order to live longer and healthier lives. Starting off, let's look at the interaction between alcohol and health. Primarily, whenever we think about health, while there are many different facets, we think of either the mind or the body, and alcohol has impact on both. With the mind, there is a hormone called endorphins. Whenever you consume alcohol, immediately you get that impact of increased endorphins. This causes a calming and relaxing effect, and sometimes is connected to certain self-medicating behaviors, because some people need that calming, relaxing effect because of certain things going on in their life, whenever it may be more sustainable to instead look at things such as medication or therapy. We also see with the mind that in the long term, it ends up shrinking the hippocampus. So this part of the brain is essential in having memory formation and spatial memory. Alcohol also has an impact on the body, such as having an increased risk of high blood pressure, heart disease, stroke, liver disease, digestive problems, as well as cancer in many different parts of the body. Whenever we're looking at alcohol, it's also important to understand what exactly alcohol is. So, we talked about how alcohol does cause that immediate increase in endorphins, but this does have some other effects, even aside from just shrinking certain parts of your brain. So, even in the short term, it can affect things such as your ability to make certain decisions, which is why alcohol can sometimes be related to driving while impaired, risky sexual activity, fall risk, as well as having a risk of drowning. It's also important to note that alcohol can disrupt communication pathways in the brain. And this is one of the long and short term impacts of alcohol usage. And this causes things such as what we're talking about with the ability to make decisions. It also affects the functioning of different brain cells. So, overall, it can have a lot of impacts, whether it's on increased risk for your general physical health, but as well as things with your mental and cognitive health. Moving on a bit from alcohol, we're primarily looking at nicotine now. Nicotine causes the increase in endorphins. Endorphins is that short term increase in those feelings of positive emotions or that feeling of relaxation, which is what we see sometimes associated with that self medication effect. The long term impact of nicotine on the mind, however, isn't so positive. It's related to an increased risk in a lot of different mental health issues. Nicotine also causes the increase in something called adrenaline, which is a stimulant to the central nervous system. This has an impact on both the mind and the body, and it can relate to the addictive nature of nicotine, as well as some of the increased risks that nicotine presents. Because we see that nicotine causes an increased risk of having a heart attack. This is because nicotine generally, but especially that increase in adrenaline, relates to an increase in blood pressure, heart rate, and the narrowing of arteries. All these things which severely increase the risk of having a heart attack. Looking at the impact of nicotine on lives, the result is pretty concerning. So we see that smoking is related to 480,000 premature deaths per year in the United States alone. And we also see that on average, people who smoke die about 10 years earlier than people who do not smoke. Related to this, the secondhand smoking is associated with 41,000 adult deaths a year in the United States, as well as sadly 400 infant deaths a year in the United States. Aside from just smoking, we can also see some evidence coming out more about electronic cigarettes or vaping. This is primarily related to EVALI. This stands for e-cigarette or vaping associated lung injury, Because vapes or electronic cigarettes are still relatively new, there is still ongoing research on what exactly the impact is. We do see, however, that in 2020 there were 68 deaths and 2,800 cases related to Uvalde. So now we kind of know generally what the impact of alcohol and nicotine is, whether it's on generally our health or on our mind and our body. One of the most helpful things to do is to try and connect with a trained professional because they might be able to help you navigate what exactly your goals are and how to get yourself there, especially with having some external support for it. It's also important to note that while we are discussing some of the potential approaches to alcohol and nicotine use, that you should complete some of these only with the supervision of a professional. Because nicotine and alcohol do have an impact on both your mind and your body, sometimes you do need professional help with decreasing or abstaining from using nicotine or alcohol. One approach is called cessation. This is whenever you completely stop using whatever substance, whether it's nicotine or alcohol. This is one of the more common approaches to addressing certain usage. There are two primary ways that we see that cessation is used. One of them is gradual. So this just means that it is spaced out over a certain time period, so you're not doing everything all at once. This, for some people, means using things like nicotine replacement therapy as they slowly get off of nicotine. So this is one of the reasons why it's important to try and connect with a trained professional, because if you do look at the nicotine replacement therapy route, they will hopefully be able to help you look at what exactly would be the safest option. Another approach is being abrupt. So this is typically what people call going cold turkey. It's important to note that if you are going to abruptly stop using nicotine or alcohol, that is important to also connect with a professional. This is because with certain substances, primarily alcohol, without having professional help, these things can sometimes have very severe consequences on your health. To some extent, it can even be deadly. So that is one of the reasons why it's very important to try and connect with a trained professional so they'll be able to help you navigate what route you should be taking and how to do it safely. Some tips overall is to look at your why. So why do you use this specific substance? Kind of cutting the middleman of using the substance, and instead trying to find your source reason of why you're using it in the first place. Another route is to recognize your triggers. Because of this, it's also important to try and prioritize that mental health approach. Because whether or not most people realize it, a lot of times using nicotine or alcohol can be related to mental health, or getting help with your mental health, or just getting general support from your community or other people can help minimize the amount of need that you have for that specific substance. Another approach that we see is moderation. Moderation is usually only related to alcohol use. This is primarily because there is typically no consideration of moderation for nicotine. It's important that if you are looking at moderation, that you should talk to a doctor or a trained professional about what drinking in moderation actually looks like for you and how you can get there. Typically, moderate drinking is associated with either 2 drinks a day for men or 1 drink a day for women. This can depend on a lot of different factors, not just gender or sex. So that's why talking to a doctor about it can be helpful, or just talking to a trained professional about maybe what your goals should be. Of course, however, it's important to note that no or limited drinking is generally best for your health. Continuing on, another approach that we see sometimes talked about is called harm reduction. So this is primarily done with the intent of reducing whatever harm is caused by the specific substance. So typically this can be related to things like using less nicotine or alcohol. It can also be a focus on generally safety. Important thing to note, however, is that harm reduction is not always effective. However, it is an option for people, primarily with the supervision of a certain trained professional. The ideal goal, whenever you're looking at your health, is typically the goal of cessation. However, that might not always be your goal, and it's important to note there are other options out there. The other thing to keep in mind is that harm reduction does not encourage usage of the substance. This means that harm reduction does not encourage you to use nicotine or alcohol. However, the focus is primarily on how to decrease the mental or physical harm caused by those substances. With this, however, even though that is the goal, it does not always decrease the harm of these substances. And for certain people, or if done in certain ways, especially without the support professional, it can actually be actively harmful or deadly. Just like how if you get off a substance suddenly, for some people that can be deadly or severely harmful. Similarly, continuation of the substance or doing it in a way that may align with harm reduction can actively be harmful or deadly. This is why it's important to be done with the supervision of a professional as well as with a support group. Some people consider things such as nicotine replacement therapy, herbal cigarettes, or e cigarettes as a form of harm reduction. However, this is something that should be discussed with a professional, as well as should be something where you understand what the consequences of all these things are and are able to make an informed decision about your health going forward. Thank you so much for listening, and if you need any help finding resources, feel free to connect with the health department.